Welcome to the 99th episode of the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert. I'm sitting here in the afternoon on Wednesday with Dr. Millicent Ravello, who has just finished a very, very long day with patients. How are you doing, Dr. Ravello?
I'm doing okay. You know why?
Why?
Because we have 99 episodes.
And the next one's 100.
And one left to go.
Is that incredible?
That's pretty darn impressive. I'm very excited about it.
We'll be talking about that on the 100th episode.
Yes,
but
we're
for
not there
today,
yet.
you don't really celebrate the 99th episode.
No, not really.
I wonder why not.
Because it's not 100.
Okay.
Like,
I'm
duh.
going to go with that. What we're talking about today is areola reduction.
Yes, this is a topic which is probably not well discussed and maybe one that people don't even know is a topic or an issue. So we are here to shed some light on that.
I did an entire episode of the Tyra Banks show back in the day on areola reduction. And it was very funny because the producers kept trying to use fruit as an example of an areola that's too big.
No, you can't. No woman wants her areolas compared to a fruit, a piece of food, any kind of food.
It was so and every time they did it, I was like, that's not going to work.
No, we cannot say
don't
that.
do that.
No.
That's not going to work. But the patient on that episode, after pregnancy, had large areolas, and she was totally distressed by it. She was like, I don't know what happened. You know, I breastfed, and now I have these giant areolas, it was totally distressing.
And it definitely can be. For some people, that's just how they are, and they don't even realize that theirs might be larger than someone else's. But for some other people, it is really distressing. And I should point out that there is no normal to what an areola should be. One size is not more normal than another. And between different ethnicities, you're going to have different sizes, different colors, different shapes. And all of that is perfectly fine and perfectly normal. But if the size is somehow bothering you, there are options to address it.
100%. And that's what we did on the Tyra show. And I think that episode is on my YouTube channel somewhere, Dr. Calvert TV. But the reality was that it actually required a periareolar reduction, which is when you take out skin of the areola in a concentric fashion. You take out the edge of the areola with an incision, and then you make, in this case, we went to 38 millimeters,
right,
which was much, I think they were 65 millimeters across. So
that's a larger areola. And a lot of times it's dependent, too, on the size of the breast.
Yeah, 65 millimeters would be
6.5 centimeters.
So it's like
about 3
inches. Yeah, 2.5.
3 inches.
2.5 inches or
Yeah.
so. Yeah, so it's not small. Some people have areolas that are the size of a quarter, and some people have them that are the size of 6 inches across. I've seen that. That's very large.
That's very large.
But they come in all shapes and sizes, and reduction is an option.
And usually I will see on my breast reduction patients, so patients that have very large breasts as well, not uncommon to have areolas that are 7-8 centimeters. That's very common. But if your breasts aren't particularly large, then if you have large areolas, it is not a good ratio per se, because more of the breast is the areola than not. And so that is what usually is concerning for patients. Now, if you're having a breast reduction, if you're having a lift, in general, your areolas are going to be reduced to something usually I do between 38 and 42 millimeters. That's sort of the average size. And it's smaller or it's large depending on how small or large the patient and the breasts are. But part of that reduction, part of that breast lift does include incisions around the areola to make it smaller. But you can make the areola smaller on its own without doing a lift, and that's more or less what we're talking about here. And typically that is done through a circumareolar approach, basically taking that circle and making it a smaller circle through incisions that go all the way around the areola. And in your case, you did it, I believe, with implants as well.
Yeah, we did implants in order to fill out the missing tissue. Plus, we reduced the areola down to, I think it was 38 millimeters. And they look great. There is a scar all the way around the areola then, which can have variable healing depending on how. I do these the same way